Hello, everyone. Welcome to our educational channel. My name is Zetu. Today, I would like us to talk about normal delivery or labor. Childbirth is known as labor or delivery. Labor can be defined as the end of pregnancy, where one or more babies will be moving from the uterus and will be delivered normally. Normal delivery is the most common way of childbirth. Once a pregnant mother has reached term, she will start having some discomfort. At that time, the mother needs to be admitted into labor room where she will be assisted throughout the labor process. Labor has got 3 stages. The first stage is the dilatation of the cervix, where the cervix dilates from 0 to 10 centimeters to allow the baby to come out. The second stage is the delivery of the baby, and the third stage is the delivery of the placenta. What happened during the first stage? On the first stage, there will be a latent phase where the mother will be having mild contraction, although she will be starting to dilate. And the next stage, or the next phase on the first stage, will be the active phase, where the mother will be having strong contraction. And those strong contraction, it means the baby is also making the way down through the delivery canal. And the third phase on the first stage is the transition stage. On transition stage, it means the mother is ready to deliver, or she is about to deliver, although she's not yet fully dilated. You'll find that this is the worst stage for the mother because the contractions will be intense. She will be restless. She needs support from the health providers, because at times the mother will be so irritated because of the pain. She will end up not knowing even what to do. And the health provider needs to play a major role to support the mother, to encourage her to take deep breaths while he's having contractions, and discourage her in pushing, because at that time she won't be not yet fully dilated. And at this time, the health provider will be getting everything that they will be needing to receive the baby. It is also important to continue with the close monitoring of the mother and the close monitoring of the baby. And because here we're dealing with 2 people, which is the mother and the baby. When you check the patient at that time, you'll find that the patient is about to deliver, maybe is about 9 to 10 centimeters dilated, of which 10 centimeters dilated, the patient will be fully dilated. And then the patient, as we are saying, is the transition state, will go into second stage, which is the delivery of the baby. On this stage, the patient will be positioned for delivery, and the midwife or the health provider will be ready to deliver the baby at that time. But even then, the mother will be encouraged to push where they inform her to push, and she must also push where not push when they discourage her not to push. And it takes not a long time, depending whether the mother is not having problems. Sometimes they have to, even to assist the mother, if the perineum is not opening up, they may even do the episiotomy, which just to enlarge the perineum so that the baby will come easily. And it is important for them to support right through and until the baby. But at this time, the mother will be in so much pain. But with the help of the health workers, she will be able to push the baby. Once the baby is pushed and the baby is out, there will be an umbilical cord between the baby and the placenta, and therefore the health providers will clamp. They will put 2 clamps and they will cut in between. 1 clamp will be on the baby's side and 1 clamp will remain with the placenta, and the baby will be taken to the mother. At this time, you'll find that the mother will be feeling some relief because the baby will be out, and the baby will be put onto mother's chest just to do skin to skin, which is mother and the baby, and the placenta will be still inside. And then the delivery of the placenta, which is the third stage, will follow after few minutes. The mother will be encouraged to take the last push, and then the placenta will be delivered. It is also important when they deliver the placenta, they will check whether the placenta is delivered completely, and they will also examine the placenta, so to make sure that there is nothing that is left in the uterus. The uterus will be massaged to encourage contraction. At this time, the mother will be cleaned and the baby, and they will be made comfortable. In other institutions, they can leave the baby with the mother for quite some time. And in other places, the baby, after it has been identified, will be taken from the baby to nursery. It depends on the institution. But for the mother, it is important for the first to 4 hours to be monitored closely for vital signs, to ensure that the uterus is well contracted and there is no bleeding. And this is very important because some complications can follow even if the labor went well. The mother can develop postpartum hemorrhage, which is the blood bleeding that can happen after delivery. Therefore, close monitoring of the mother until they are satisfied that there is no complication or no immediate complication, and then later maybe the mother will be transferred to the ward. For today, we will end up here. If you do like these short videos, please subscribe, share, and comment so that we'll continue with these short videos. Thank you for watching. Till next time, stay safe and be protected.